My name is Edward Wasie, and I'm a family nurse practitioner. Empathy, I think, is important, and it's more important to, write off a script and hand it to somebody and say, here you go, or if you sit and talk and kind of work out a lot of problems. I think most of the time folks appreciate the time spent, more so than just, here's the answer and there's the door kind of thing. So I do spend quite a bit of time visiting, talking. I'm not a big person as far as writing out a lot of scripts. I tell people less is more. And I try to deal with lifestyles more than medications. When something happens, we rely on EMS to kind of come in and help out. We can do EKGs, but I'm not a cardiologist and there's no cath lab, of course, so it's send off. So lots of urgent or emergent transfers that take place. And also I think the Islanders themselves understand that this isn't a place where you can walk in and get an ultrasound or x-rays and all that type of thing. So anybody who has lived there for a long period of time knows that if something happens, they have to kind of come down here to the emergency department. I'm more of an educator, and just talking through some things are oftentimes kind of helpful for folks. So in weight loss, heart disease, diabetes, a lot of it's, if people understand what's happening, then I can kind of move them, push them towards better health if they understand what's happening. So I think more of, just kind of giving them the facts and doing the education part. Good day, people come in. I like fish hooks and more handsy kind of things. Where laceration repair, someone comes in, they're hurting, they're panicked, and they walk out going, wow, that wasn't so bad, and thanks a lot.